We do expect pain after the surgery, and we will manage that typically with Tylenol and ibuprofen. I will also provide you with a narcotic prescription, which you can take as needed. Important to note that you should take a stool softener if you're using narcotic pain medicine to avoid constipation. To reduce swelling after the surgery, I will wrap the genitals with a gauze, and that will be removed the day after surgery in the urology clinic. Beyond that, it's important to wear tight-fitting underwear, which would provide scrotal support, which can help also reduce the swelling. The incision will be closed with sutures that will absorb on their own. Also, it's typically covered with a surgical glue that will help hold the incision together, which will fall off on its own over a couple of weeks after the surgery. You can shower, just don't take any baths or soaking for 2 weeks after the procedure. 1 week after surgery, you can start to gently pull down on the pump in the scrotum. The purpose of this is to make sure that it stays low in the scrotum and doesn't become a high-riding pump, which is not as convenient to use. And in order to pull down on the pump, you just gently pull a few times a day. Initially, it will be tender, sore, and you can just pull gently. Beyond that, you can pull a little bit more firmly, just again, to pull the pump down into the lower part of the scrotum. After surgery, you may experience pain and require narcotic pain medicine. Narcotic pain medicine is notorious for causing constipation, and I highly recommend using a stool softener like Docusate or Colace, as well as another medicine, Miralax, which is the generic name is polyethylene glycol, which can prevent that constipation. With the incision, I recommend only showering 24 hours after the procedure and no bathing or soaking for 2 weeks after the procedure to allow the incision to heal. As for lifting restrictions, I recommend no heavy lifting over 10 pounds or any strenuous activity for 2 weeks after surgery. I ask that you wait at least 24 hours after anesthesia before you would drive a vehicle. Also, it's important that your pain is well enough controlled that you can make a quick movement going from the gas pedal to the brake without being inhibited by that pain. At that point, you would be safe to drive. As for work, it depends what work you're doing. If you're working an office job, not moving too much, then typically after a few days or a week, you should be able to return to work. Most guys are going to want to really relax for a few days after the surgery. And by that, I mean just stay at home, walk around, do easy, light household chores, making a meal in the kitchen, but mostly relax on the couch for those first few days. Then, day by day, the pain will get better, you may require less pain medicine, and you can resume more normal activities. If you develop fevers or chills, if you see pus coming out of the wound, or if it opens up and if you see any part of the implant exposed, that would be a reason to give me a call. After the surgery, you will be scheduled for a visit in the clinic with my nurse the first day after surgery to remove the Foley catheter drain in the bladder, a surgical drain, and the gauze. Then I will see you at 2 weeks and 6 weeks after the surgery. All of these should be arranged at the time that your surgery is scheduled. Most guys are able to use the device 6 weeks after the surgery, and this in part depends on how comfortable they are in squeezing the pump. If there is tenderness, we could always wait a couple or few extra weeks in order for it to be more comfortable when activating the device by squeezing that pump. If you have any questions or concerns after the surgery, please call our office, Rockford Urological Associates, and ask to speak with my nurse, and we can try to answer your questions.